What causes pain in the small of your back? I'm Dr. Dave Candy, and in this video, I'm going to explain what it means to have pain in the small of your back, when it might happen, and what you can do to be able to stand and walk more comfortably without having pain in the small of your back. So first of all, what does the term small of your back mean? I actually had to look this up not too long ago because you hear people say it a lot, but what exactly do people mean when they say it? And for the most part, the small of your back is the narrow part right above your waist where the spine kind of curves inwards a little bit. And that's usually around the L5, S1 area. For some people, it's L4, L5, but it's sort of the part where your spine dips inward and it has a narrow curve. And it looks smaller than the rest. So that's why it's called the small of your back. Now, as to what causes pain there, because it dips in, that sharp dip usually means you're compressing the joints together more at that area than you are at the joints above and below it. So people often tend to develop central pain in their spine right at the small of their back where the curve goes inwards really sharply. And that's most common when people are standing and walking. So when you're standing or walking, that's a really common time to have pain in the small of your back because you're in an upright position where it further jams things together. Conversely, if you're sitting down or if you're bending, you may feel more muscle pain, but it's not usually right centrally in the small of your back when you're doing more flexion-based activities versus extension-based activities. So what can you do to relieve pain in the small of your back if you do get pain when you're standing and walking? Well, largely, you don't want that curve to be super sharp at one area. Normally, the curve in the lumbar spine, the lordosis it's called, should be kind of a smooth curve that looks more like a C. It shouldn't look like a sideways V or a greater or less than sign, depending on which side you're looking at it from. It should be more of a smooth C curve. And so the less hinging you can get at one segment and the more you can get it to be more of a smooth curve, the better off you're probably going to feel. And so what that means is instead of standing with a lot of arch at one point in your back, you want to try to kind of roll your pelvis underneath and flatten your spine. Now, some people get in the habit of standing like this their entire life where they're kind of hanging back on their hip ligaments, their back's a little bit hyperextended, and if they've done it for a really long time, it may even feel normal. Truth be told, I have the habit of doing that. Now, the good news about correcting your posture is that it can actually make you look a little bit thinner because when you stand like this, it looks like your belly peaches out versus when you stand more upright, it makes you look a little bit trimmer. The other good news is it doesn't hurt quite as much in the small of your back when you are standing and walking. Now, if you tend to get pain in the small of your back when you're walking, if you tend to lead with your heel first, that puts you more in an extended position versus if you push off your toes and you're kind of leaning forwards when you're walking, that kind of opens up the spaces between those joints at the small of your back where they're compressing together, and it helps you not have quite so much pain when you are walking. So to review those tips, when you're standing, you want to roll your pelvis underneath and kind of flatten your spine out. Now, if you have difficulty doing that, you may feel like you need to bend your knees a little bit in order to accomplish that, and that probably means that you have some stiff hip flexors. So stretching your hip flexors with one leg forward and one leg backwards and tucking your pelvis underneath so that you flatten your spine out, that's a good way to help facilitate it and make it a little bit easier to tuck in and flatten your spine out when you are standing for long periods of time. So that's the standing tip. Again, the walking tip is leaning forward, pushing off of your back foot using a rear wheel drive rather than pulling yourself forward with your front foot, because that puts you in more of a back extension position when you pull forward with the front foot. So hopefully you find these tips helpful and they do help you to be able to stand or walk longer with less pain in the small of your back. If you try this and it helps you out, leave a comment below. And if you find this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.